Hey guys, how's it going? This is Dr. Michele Frawley here from Beverly Hills Dentistry, and I wanted to address a question that we get a lot from our patients who are coming in looking for veneers or looking to redo their veneers, and people, messaging us on Instagram like, I know you guys are out there, I know you're looking for answers, so I wanted to take the time to answer some of your questions. So again, one of the biggest questions we get is, how long should veneers last? And then alternatively, when should I replace the veneers that I already have? So, how long veneers last, you could ask 4 or 5 dentists and you could get 4 or 5 answers. In my opinion, veneers should last, for as long as you can have them, which basically means if you're taking good care of them and everything was done right, they should last you your lifetime. Okay? Now, if you're 20, maybe you'd have to replace them once in your lifetime, maybe twice, and we'll get into that. But what are the things that make veneers successful? Okay, so first of all, proper planning. It's really important that you do a smile design process to look to see how the veneers are going to fit in your smile, align with your eyes, your nose, the shape of your mouth, where your lower lip line hits. So a lot of different things, and we use a digital smile design process to help determine that. So once you determine where the teeth look good in your face, well then you have to see, what do the teeth look like underneath that, and how much tooth structure will I have to take off to get them to look that way. I know many people are very concerned with taking off a lot of their tooth to get veneers. That's probably one of the #1 questions we get, right? It's important that your teeth are in the right position. So, back in the 80s, people did veneers, the teeth were all every which way, and they just cut them down into little nubs and they put veneers on, right? So now those people are coming back saying, I don't necessarily like how these look, or I want different color, or this one broke off, or this one got a cavity around it, right? So proper planning, making sure the teeth are in a relatively aligned, good position, will make the removal of the tooth structure very minimal, just to be able to put the thickness of the porcelain on top of the tooth. So, proper smile design, proper preparation of the teeth, right? So very minimal. You want to keep it in the enamel of the tooth. So teeth have 2 different compositions. One is the enamel, which is kind of what you see when you look at it there. The under layer of that is called dentin. So if you are very conservative in your preparations, you can keep it all on enamel, and then when you bond on the veneer, it's bonding to enamel, which is a very strong bond. If you end up having to go into the dentin of the tooth, which is about 1 millimeter, 1.5 millimeters into the tooth, if you have to get into the dentin for your preparation, the bond strength is not as good, and therefore potentially the bond overall is not as good and could debond or break off or get a cavity in it when you're into dentin. Sometimes we have to do that, but when at all possible, we really try to keep it in the enamel and a very healthy, easy area for you to clean, and a nice connection between the veneer and the tooth. So the other part is, once you're ready to cement your veneers, how do you prepare the teeth? How do you prepare the veneer? There's certain chemical processes that happen, and so really making sure you're following all of these different steps to ensure the best bond of the veneer to the tooth is really, really important, right? Because if you don't get that, it will start to leak at the margin of the tooth, and oftentimes that's when you get a cavity and you'll start to see the stained edges of the veneer, and then that really becomes unsightly, and that's probably another reason why you want to get it replaced if you just start seeing, all of some staining on the edges. Another thing is that if the veneer is not contoured properly, the veneer ends up sticking out farther than the tooth, and then it makes your gums all inflamed. And so maybe you have this, or maybe you've noticed people where, it just looks like all their gums are really red and puffy, and that's because bacteria is collecting right along the edge of the veneer because it's not flush with the tooth. And so then, if you do get your gums healthy, then the gum will recede, and then you see the edge of the veneer lower than the actual gum line. And so then, that might be another reason why you'd want to replace them, because you've had some gum recession, either due to, potentially, aging, but more so just not necessarily a good bite or a good proper hygiene. So those are things to look at. Once you've gotten, proper design, proper tooth preparation, and proper cementation, you want to make sure, as part of that planning though, that the bite, how their top and bottom teeth are hitting, both in the front and the back, is nice and stable. If that planning wasn't done appropriately, you could have veneers that look nice, but then the bottom teeth keep coming and hitting on them, and then that can cause them to break. So proper bite planning is really important. And then also, lots of people are stressed these days, especially now, in the pandemic, so lots of people are grinding their teeth at night or clenching down, and it's really important that even if when the bite is properly aligned, that we help counteract some of these habits that we have at nighttime, and make either a night guard or a retainer, something to go over the porcelain veneers to help protect them, mostly at nighttime. So wearing that many nights, over years, will help to protect the edges of the porcelain. You can still eat normally and chew everything that you want, but it's just those forces that really could are very strong at nighttime that you don't realize that could cause some of the porcelain to chip. So, that's kind of how long do they last? 15, 20, 30, 40 years. I mean, we see people on average come in probably after about 20 years saying, okay, now I'm ready for a new set. Their faces changed at that point. Maybe they want a different look. Again, maybe they've had some gum recession and they want to, make the veneer look a little bit longer to match where their gum line is. Sometimes people, they come in and one broke, and then you kind of start looking at the other ones, and maybe they're not bonded properly, and so there's some staining, and so kind of looking at the conversation of, if we're going to replace one, let's look at all the other ones, because those, might need replacement too, and it's a good time to plan, do a proper smile design and plan. So I think that's it for that topic. If you guys have any questions, please feel free to leave us some comments. We are looking and we'll definitely answer your questions. If you have any other topics that you'd like us to talk about, please leave that as well. And if this was helpful, please follow us, and like this video. So thanks a lot. Take care.